So as Jerry was saying, my name is Eimear. I'm a researcher in the School of Psychology, and I've done my PhD as part of the mHealth research group here in the school. So my PhD was about medication adherence and hypertension, and I'll be talking about the last study that I conducted as part of it. So it was one where we kind of got patients' perspectives on using smartphone apps to manage hypertension. So just a bit of background first of all. Hypertension is a chronic condition in which the blood vessels have persistently raised pressure, so it's more commonly known as just high blood pressure. And it can have, despite not having any symptoms, it can have a lot of negative effects on the body, so it's one of the leading causes of stroke and heart attack, and can also be a contributing factor to things like kidney disease and vision loss. It's really common, so the WHO has estimated that about 1 billion people in the world have high blood pressure, and this is likely to go up. And then within an Irish context, about 63.7% of adults over 50 have hypertension. So that was defined as either having a reading of 140 over 90 milligrams of mercury and or taking an antihypertensive medication. So when you think about that, that's at least 2/3 of everybody over 50 in Ireland. So it's a really common condition, and it does have these really negative health impacts. But it's not all bad news, because the medication that you take for hypertension is really, really effective. It's one of the most effective kinds of medications out there. So placebo-controlled trials have shown that these kind of medications can reduce the incidence of coronary events, the incidence of stroke, and the incidence of congestive heart failure. And this has been shown over and over again in systematic reviews and meta-analyses. There's been lots of Cochrane reviews as well that have kind of supported this claim. But hypertension still is a global epidemic, and this is because there's a significant problem of non-adherence to antihypertensive medications despite their effectiveness. So estimates of low adherence to hypertension medication vary between 50 to 80%. So it's estimated that about 2/3 of people who are prescribed an antihypertensive medication will have stopped adhering properly within 1 year of taking of getting their prescription. So that mightn't mean that they have completely stopped taking it, but it means that maybe they're missing days here and there. So it's a really big problem. And there has been lots of interventions in the past from lots of different areas, because it is such a big problem. There's been interventions done kind of in medicine, in nursing, in pharmacy, in psychology. And what's kind of been found across these interventions to be quite effective is medication reminders, so using some kinds of prompts or cues to help people to remember to take their medication, and also self-monitoring of blood pressure. So as I mentioned earlier, hypertension doesn't have any symptoms, which is one of the reasons why people find it hard to remember to take their medication. But a kind of proxy I suppose physical measure of hypertension is for somebody to self-monitor their blood pressure at home. So when somebody can self-monitor their blood pressure at home, they can see that taking their medication is leading to a reduction in their blood pressure values, which then will increase their motivation to continue taking the medication. So we've heard a lot today about lots of different smartphone apps and websites and things like that. And there definitely is room for digital platforms within this area. So digital platforms offer a new scalable and potentially cost-effective way to deliver these interventions to improve medication taking behaviours. So I suppose smartphone apps are probably the most common kind of digital platform that we all use and engage with at the moment. And there has kind of been a proliferation of these kind of apps within the hypertension self-management market in the last couple of years, and they're getting really common. But I suppose it's come up a lot today, and Brian mentioned it there in the previous talk. All these things need to be centred around the user and around the person who is going to be using this kind of technology. And it remains unclear whether these kind of smartphone technologies are feasible, acceptable and usable for people with hypertension to manage their adherence to their medication. So as part of my PhD, we had done all this background work around examining the different kind of apps and looking at the different kind of interventions that were useful. And we felt that kind of the next step to take was to talk to the patients themselves and ask them what they thought of an app to manage their hypertension with and what they would like to see in one. So the aims of this study were to explore the patient's experience of managing hypertension and adherence to their antihypertensive medications, and also to elicit their attitudes towards the use of technology to support this kind of behaviour change. So it was a focus group study that I conducted in Cree. So Cree is the West of Ireland Cardiac Health Centre. So it's just up in Newcastle Road, and it's a really good charity, and they do lots of work around cardiac rehab and education courses and things like that. So we recruited our patients through Cree. So we had 24 people with hypertension, and they had to be prescribed at least one kind of antihypertensive medication in order to be included. And then we sampled proportionally based on age, sex, how long it had been since their diagnosis, how many medications had been prescribed, and whether or not they were experienced with technology, because we wanted to get people who were experienced and also people who weren't experienced or weren't interested as well to get their views too. So there was 8 focus groups altogether, with 3 to 5 participants in each group. And we had a topic guide that was based on the literature and then piloted with one group, and we used iterative approach and thematic analysis. So I sat down and I talked to them, asked them, how they felt about having hypertension, how they dealt with it, what they thought about maybe using an app. And then when we kind of got to that halfway point, I showed them an app, which is a typical app for hypertension management. So it's this app called MyBP that was developed here in NUIG in the Department of General Practice by Professor Liam Glynn. So it's like any typical hypertension management app. It consists of 2 main parts. So the first part is just a simple reminder to take your medication every day. And the second part is this home blood pressure monitoring. So the MyBP app can link up with a blood pressure monitor through Bluetooth, and then the person can just take their blood pressure and the reading will be fed into the app, and then they get this kind of graph of their blood pressure over time. So the participants saw this app and interacted with it during the focus group. So in terms of the characteristics, the mean age was 64, so ranging in age from 49 to 83, so that kind of was representative of the kind of typical age of a hypertensive cohort. And it was kind of evenly divided between males and females, and we had a lot of people who were full-time employed or retired. It was kind of a nice representative sample. And then a kind of multidisciplinary group of us came together and talked kind of through it. So I had done the initial coding and analysis, and then we talked through the rest of it and kind of tried to brainstorm and came up with this really messy qualitative analysis. So we took the thematic analysis then came from that. So there was 5 of us in that multidisciplinary group. So there was me and my 2 supervisors who are health psychologists, a GP and a nurse. So in terms of the results, 3 themes were generated from the data. The first was development of digital competence. So we saw this as the pathway to becoming familiar with and using technology to manage hypertension. So you can see there's a couple of different examples here. This lady said, it's good, but you'd need for it to be explained. I think initially if you get one lesson and if it was explained to you and you get one follow-up, I would think I would use it then. So you can see there somebody who isn't very familiar with technology but is willing to try it and give it a go if she could just get some help with it. And then this guy over here, this male said, I wouldn't see myself using the app at the moment. I have an old notebook beside the blood pressure monitor, and if I think I need to record something, I'll just stick it down into that. So there's an example of somebody who is very much not engaged with this kind of technology and doesn't have any interest in it. And then this lady says, I use apps already and I would definitely use this one because it's your health and there's nothing more important than that. So this lady was quite far along in her development to digital competence and was quite motivated by the idea of improving her health. So the next theme that we saw was rules of engagement. So this was the patient's motivations to engage and disengage with different features of the app. So this real kind of divide emerged within this group. So we could see people who were really keen to monitor their blood pressure, sometimes maybe to too much of an extent. So this guy said, yeah, I bought a machine straight away. I was testing myself 3 times a day and before I'd see the consultant. I'd check myself 3 times a day and then I'd give him an Excel sheet with all my readings on it. I'm too young, like. So this guy was really engaging with the monitoring, whereas another lady said, I think it could make you hypochondriac at times, that something could go wrong and you go running off to the doctor. So we really saw this within this group, within this theme, that people weren't sure what the appropriate amount of engagement with self-monitoring was. And then our final theme was sustainability. So this was the participants' thoughts and feelings around maintaining self-management and the use of the app in the long term. So a lot of them had ideas about features they'd like to see in the app and things that would mean that they'd be more likely to engage with it for a longer period of time. So I think this person said, I'd probably use the blood pressure monitoring part, but there would have to be better stringent kind of regulations and I'd want to be made aware of them. So I suppose that kind of feeds into the discussion that we've been having around GDRP or PR, whatever it is. Not tuned into that. So they kind of wanted to know about those kind of things before they could really commit to using the app in the long term. And then people really recognised as well that maybe they mightn't be that interested in using it, but maybe the younger generation, as they moved along, would like to use this kind of a thing. So this lady said, my mother wouldn't be able to use this because she didn't grow up with it, but I can see my own kids in their 30s, if you ask them the weather forecast, the first thing they go to is their phone. So I think that generation will definitely use it. And then there was other small things that people liked or didn't like. So this person said, I just think that not everyone who has an app would want to invest in buying a blood pressure monitor. And that's a really fair point. And some people as well weren't happy with the idea of having to have an extra piece of equipment as well as their phone to keep track of it, and they just weren't interested. If it wasn't really straightforward and simple, they didn't want to know about it. So that was what we found in terms of the themes. So we found really that people liked the reminders, they found them useful. They also thought that this kind of self-monitoring could empower them. So a lot of them talked about how they'd like to have all the data before they went into the doctor, because then they'd be able to have a better conversation with the doctor about their blood pressure. But at the same time, there was concerns around sustainability and health anxiety. So in terms of the strengths and limitations, it was just focus groups, and it might have been good to do some follow-up interviews afterwards. We did have a multidisciplinary research team, so that was really good. 2 people on the team were from a kind of a clinical practice, so we're used to dealing with patients. So it was good to get their feedback in it. It would have been really nice as well, maybe, and something I would do in the future when doing qualitative research, to have somebody with hypertension participate in the thematic analysis too, just to get their kind of thoughts and feelings on it. We were confined to one geographical location, so it was mainly in the west of Ireland, but these findings are consistent with others, particularly within the UK. So that paper has just been published in Patient Preference and Adherence, if you want to read more about it. And I'd just like to acknowledge my co-authors, so Jerry and Jane, and Professor Liam Glynn and Monica Casey. Also, obviously, the participants were fantastic, and Cree too. So thanks very much.